And we formerly had a navigation task force. At this point in time, we do not have a active navigation task force. So this is more of an open discussion around what navigators need, what resources they want, things like that. We can talk a little bit about some things that we have done, but this will really be more brainstorming of, where should the coalition be focusing their efforts around navigation. So, and if you do have to hop off, I popped some links into the chat with the evaluation. So please scroll up and find that, or find the virtual exhibit hall and go say hello before you head out. So Becky, do you have anything else to say at intro for this session?
Really, I think you covered it. Mainly, we just want to know how to better support navigators. So yeah, the next slide, I think there's only one slide. But we can talk through a few of these, and can you hear me okay? I've had some random issues with my mic.
Yes.
Okay. Okay. So I'm going to say a couple of years ago, the navigation task force, when we had one, decided to create a private Facebook group called the Colorado Cancer Coalition Navigator Network. So I put the link on that slide. Let me see if I can chat it as well. This is what happens when you multitask. Let's see. The intention for this group was a private place where those who work in some form of navigation can come together and be able to share resources and trainings and bounce ideas off each other. It was modeled off of a similar social group, a social work Facebook group that has over 2,000 social workers, and there's tons of information sharing and networking going on. So that was kind of the intention of this group. It has not really taken off, but we wanted to keep it around just to see if it does provide a tool. It's not intended to be a place for navigators to be sharing, personal information about anyone they're working with, but provide enough general information if they have someone who's looking for a flight, for example, or, survivorship resources, and to be able to get some help with that. So that is one thing that's available. And if it seems like it's useful, we'll keep it. And if not, we can stop using it. Christy, do you want to talk about the Navigator Night Out events that we had done in the past?
Sure. So in collaboration with the Academy of Oncology Nurse Navigators, we helped create a chapter of that, and then started hosting Navigator Night Out events that focused on providing education and networking. So there'd be sometime, did they get CEs for that or no? I can't remember.
No, because they were sponsored by pharma.
Okay. But so the main goals were education and networking, and they were so well loved. They sold out pretty much instantly. So one day we'll bring those back. Yeah, I look forward to when we can all meet in restaurants again.
Can those be done virtually?
There has been some talk about that, but I don't think we've gotten to that point yet.
Because that might be a platform that actually works, where people bring their, have dinner and time together in that way.
I've seen these very beautiful charcuterie boards that you can order and send out. So maybe if we got someone that could sponsor it well enough, we could send everybody a nice little dinner.
Mm-hmm.
I like it. Also wanted to mention the Alliance, which we refer to it as the Alliance. It's the Alliance of Community Health Workers, Patient Navigators, and Promotores de Salud. So the website is up on the slide, and Andy was going to be here to speak a little bit more about them, but she was unable to make it. But she said they would love new members and have prioritized more programming after the first of the year, and are looking forward to partnering more with the coalition. So they're not focused specifically on cancer, but that's obviously a large portion of what their navigators do. And so we're exploring ways that we can collaborate more with them as well. So just another resource. And then of course, as we've mentioned in the past, the coalition newsletter that gets sent out has always has a ton of resources available in there. So that's another resource for navigators, but you know, just interested, I don't know who's on here who works kind of in that field, but would love to kind of have more of a discussion about what would be helpful. How can we better support navigators in the important work that you all do? And any questions about any of the things we just talked about?
This is Emily, nurse navigator at Sarah Cannon. I think it's just, even just the resources that you guys provide, part of our job is, big job is finding resources for patients. And throughout COVID, that's been really difficult because a lot of resources have stopped or, you know, haven't quite figured out how to, you know, go to online or things like that. So all of the resources that you guys continue to provide information on are amazing, and we really appreciate them.
That's great. And are you referring to the kind of the main email communications that go out?
Yeah.
Either way, there's a really good one that just came out from Triage Cancer, which is a national program that provides information and guidance around insurance, disability, and patient rights related to cancer. And that's a very good resource site too. They also have quite a bit on financial assistance. They have a whole sub website just for that.
I also can't believe we forgot to put this in the slides. We have started a peer sharing series with the American Cancer Society, the Colorado Cancer Screening Program, CDPHE, and the Coalition. I might be forgetting someone, but we've started this peer sharing series. And our next topic actually is going to be on virtual community outreach and navigation. And the whole thought behind these peer sharing series is how they're set up is we'll share one case study on a specific topic, and then mostly we're hoping people come with their own questions, but we'll also have a facilitated questions to keep the conversation going. But it's really a place where, I know we said this a lot, but where best practices can hopefully come out. So you don't feel like you have to reinvent the wheel. We always hear, people hear of new resources that they didn't know existed. So look for emails for that. I also posted the link in here for that. We haven't fully decided the topic for December, but January's topic is going to be on cervical cancer, and we'll hear from Ute Mountain. Is that how you say Ute? How do you?
The Ute Mountain Ute Tribe.
Yeah, we'll hear from a storyteller from there. So those agendas are filling up nicely. So that's one other thing we can provide. Anything else to share on the peer sharing? Okay.
Is that information generally available on the Coalition website, for anyone to access?
Yes, there's a new, under programs, I think there's a new tab now called, or new navigation called peer sharing, where you can find that.
And it goes out in the newsletters. Right, I think, right?
Yes. Other thoughts on ways we can help the navigation community? I know we should talk about this in the last one too. I feel like often whenever I meet patients or we have patients come speak for a coalition related event, they say that they didn't find out about any of these resources until they were done. And I don't think that is I think it's because there's not enough navigators. I think navigators are great in getting people connected, but I don't think there's enough of them. So patients are just falling through the cracks. So until we can figure out the whole navigation workforce and make it bigger, How do we try to help patients find these resources when they need them? I forgot who it was that shared, it might not have even been this conference, but they shared when somebody gives you information verbally, you maybe retain 20% of it. And then so, you sit the patient down, you give them all these resources, they walk out, they forget it all. So how can we make sure they're finding and getting the right information when they're at a time where they can soak it in?
Well, my hope would be is that the navigators and the social workers in all the cancer programs collaborate together, because they're constantly interfacing with patients, but at different times, and they have access to many of the same resources. So hopefully they're talking to each other and connecting with each other in a timely way. I know, at least in the oncology social work practice, the intention is to sort of monitor how much information you give at a time, because people can't take it all in, and that it's really relevant to what they need at the time, and then to follow up in terms of their ability to access it or the results of their contact. One of the things I like, if any of you've been exposed or learned about the Aunt Bertha resource, is there's actually a way to track referrals that are made and whether or not patients actually went to that referral and got the information they needed. So the auntbertha.com website allows you to register or go in anonymously, but if you go in as a professional or as an individual and register, everything that you've researched or tracked is kept in your sort of personal file. And so as a professional, you can even track every time you made a referral on behalf of a patient. And that's useful. And it's free.
Christy, I also think once the Office of Community Outreach, whatever it's called, sorry, whenever their map is finalized with kind of everything you shared yesterday about geographical resources and all of that, if we can make sure that we really promote that to everyone, I think that can be super helpful, because I think so often we hear about the resources that are in Denver, but for everybody that's outside of Denver, knowing kind of what resources are available in their communities and their surrounding areas can be really important.
Point. Does anybody know of any patient tracking software that's compatible with Epic? Does something like that exist?
Yes, I think out of, is it George Washington University? They have a pretty robust patient navigation tracking software. And I believe it's compatible with Epic.
We have one at Sarah Cannon, but obviously at HCA we use Meditech. So, and it communicates with Meditech, but throughout the whole HCA network, Sarah Cannon, we use a software called iNavigate.
Most of those platforms also have somewhat of an expensive cost, so it kind of depends on how much you want to use it and pay for. I know a lot of case management programs are using Salesforce, but there is a fee for that as well. The George Washington University program, though, my understanding is it's free.
They're all great suggestions. Kirsty, were you just going to say something?
I was just going to ask if there were other thoughts or questions or suggestions.
If you have other ideas later of, programs or anything like that that we can help support, you can email info. I think the next slide has just the general info email address. You're welcome to reach us there.
I also think too, just you guys helping to encourage, continue to encourage collaboration with multiple, we all work in different healthcare systems. We all work in different areas of the state. So, you know, any mode or like way that we can all get together, whether it be over Zoom or, you know, the Navigator nights out, I think it's really important that that you guys continue to promote collaboration, which you already do. But it's so nice to hear other people's, you know, what other people are doing, other resources, like you said, and just to connect with people who are, you know, navigating the same, you know, working with the same patient populations that you are and probably encountering some of the same difficulties.
Great. If we don't need to just hang on if no one else has anything else to say. It's been a long 2 days. So if we're good, then just want to say thank you all for your time and engagement.
Yes, I second that. Ian, can you just stop sharing for a second?